Ladies and gentlemen, Sir Gustav Nossal.
Your Excellency Governor Linda Dessau, Minister Greg Hunt representing the Prime Minister, old and current heroes and heroines of CSL, distinguished dignitaries from many walks of life, ladies and gentlemen. It is a privilege to participate in this exciting centenary celebration. It's actually also quite a sentimental occasion for me, because my old place of work, the Walter and Eliza Hall Institute, is just a wee bit older than CSL. It in fact started in 2015, and it's been joined at the hip with CSL from the very beginning. I treasure CSL as a true icon of the Australian pharmaceutical and biotechnology scene. Naturally, I also value its extraordinary commitment to research and development. This story actually begins quite tragically in 1915. On April the 23rd, 1915, the University of Melbourne and the then Melbourne, now Royal Melbourne Hospital, formally established the Walter and Eliza Hall Institute and appointed a brilliant young Australian medical researcher, Gordon Clunes Matheson, as founding director. Matheson had impressed not only his Australian mentors, but also a variety of British medical scientists as being truly outstanding and full of extraordinary promise. But Matheson had quit his research position in London to join the AIF as an ordinary doctor. He was part of the landing at Gallipoli. A few days later, as he was tending to the wounded very close to the front line, he was hit by a stray Turkish bullet, and he died a few days later. He never knew of the great honour that had been bestowed on him in Melbourne. There, the powers that be declined to appoint a replacement, but offered the generous laboratory space that had been set aside in the Melbourne Hospital for the Hall Institute to the Commonwealth Serum Laboratories, newly founded in 1916, providing ample space for it while its own laboratories in Parkville were being constructed. CSL's first director, William Penfold, accepted eagerly and got straight to work before the permanent site was completed in 1918. The CSL Hall Institute partnership was further cemented in the 1920s when two long-serving directors of the two institutions, Frederick Morgan from CSL and Charles Kellaway from the Hall Institute, collaborated on research and development of snake antivenines. Even in those days, it took a long time for research dreams to be turned into clinical realities. The first tiger snake antivenin was released in 1930. Morgan went on to serve for 29 years at the helm of CSL. From the very beginning, CSL was fast and nimble in bringing the fruits of biotechnology research to the Australian public. For example, insulin was discovered by Banting and Best in Canada in 1922. Quick off the mark, CSL started producing insulin in August 1923 and soon was making enough to treat all Australian diabetics. Let us fast forward to 1939, when another world war was starting. A bright young scientist, Percival Bailey, universally known as Val Bailey, born in 1909, joined CSL. Just like Matheson, he felt he had to serve his country more directly. And in 1941, he enlisted in the AIF, rising quickly from captain to major. However, he was brought back from New Guinea once more to CSL to head a team tasked with producing the new wonder drug penicillin. This had been discovered by Fleming in 1929, but developed as a usable product by the Australian Howard Florey in 1939. By Christmas 1943, the efforts were crowned with success, and the first batches of penicillin were shipped to New Guinea for use in soldiers with wound infections. A somewhat unsung hero in the saga was the backroom boy responsible for much of the extraction and purification, Harold Cochrane, who lived to nearly 100. As a result of the team's efforts, Australia was the first country in the world to have penicillin available for the civilian population. This was in 1944, only 4 months after the troops. Not content with this triumph, Bailey went after another first. This concerned the terrible disease poliomyelitis, or infantile paralysis. Now, it's not easy to recall the fear surrounding polio. When summer epidemics struck, as they did every few years, I remember in my own childhood, my mother wouldn't let us have our normal Saturday afternoon entertainment, namely going to the cinema, nor would she let us go to the swimming pool, for fear that I and my brothers would catch polio. Hospital wards were full of children in respirators who couldn't breathe for themselves because their diaphragms were paralysed by polio. After pioneering work by the Enders Group at Harvard, Jonas Salk had developed what came to be called the Salk vaccine, consisting of poliovirus particles killed by formalin. Bailey hopped onto a plane to Pittsburgh, learnt whatever Salk could teach him, and by 1956 Australia was the first country in the world after the US to deploy the vaccine thanks to CSL. Soon 5 million doses were being produced per year. 25 million doses were injected into Australians free of charge, and as you've heard, the disease was briskly and finally conquered in this country. Bailey's career at CSL came to an unfortunate and abrupt end in 1961. Prime Minister Robert Menzies determined that CSL should operate along more commercial lines and should therefore become a statutory corporation, initially with the Commonwealth as the only shareholder. Bailey contested this, fearing it would threaten his research agenda and CSL's main role as a defender of public health. Having failed to make any headway through internal procedures, he took his concerns to the public through news releases, interviews, and so forth. This was deemed quite inappropriate for a public servant, and Bailey was demoted to an ordinary medical officer with a considerable drop in salary. Not surprisingly, Bailey took an indefinite leave of absence and rejoined Salk's lab in the USA, never to return to CSL. I had the good fortune to get to know Bailey before that time, and while no doubt he was a feisty and controversial character, he was extraordinarily adventurous and effective. We owe him an enormous debt. And indeed, I've been fortunate enough to be friendly with the subsequent CEOs of CSL, Lorne Greville, Bill Lane, Neville McCarthy, and Brian McNamee, and I have learnt much from each. Bailey actually need not have worried. There is indeed a tension between CSL as a competitive commercial manufacturer with a profit motive and CSL as a national public health and research resource. But this tension is resolvable. In 1977, Malcolm Fraser asked Mr. J.B. Reid and me to conduct an independent inquiry into CSL, the results of which we published in 1978. During the process, we became enormously impressed with the national insurance value of CSL. While we felt comfortable with the corporate model, which morphed in 1991 into incorporation as a company and in 1994 into floating on the Australian Stock Exchange, most of our recommendations served to protect the national interest role, and all were accepted. The further history proves the point. In 1966, Australia was the first country in the world to prevent hemolytic disease of the newborn, the dreaded Rh disease, which can affect Rh-positive children of Rh-negative mothers, through the use of anti-D serum manufactured by CSL. Skip to 2005 and look at 2006 and look at CSL's Gardasil, the vaccine against the human papilloma virus responsible for cervical cancer, or to 2009 when CSL supplied the H1N1 pandemic influenza vaccine to 5 countries. By the way, still the Hall Institute joined at the hip. It was, of course, Macfarlane Burnett's methods of growing the influenza virus in fertilised hen's eggs that CSL used to make this vaccine. Think further of the wildly successful collaboration between CSL and the Australian Red Cross in the supply of precious blood products. All these public health advances coexist with great commercial success. And what of the future? CSL's commitment to research and development grows apace. In 2016, CSL will spend an extraordinary 800 million Australian dollars on R&D. It is committed to spanning the spectrum from basic research to applied research and development through to clinical trials and commercialisation. As such, CSL and its 1,100 research staff are valued partners for much of Australia's academe. Quite recently, Prime Minister Malcolm Turnbull announced a $36 million expansion of the Bio21 Institute to accommodate an expanded CSL research hub on the collaborative Royal Melbourne Hospital Walter and Eliza Hall Institute campus. Ladies and gentlemen, all these considerations prompt me to surmise that CSL's next 100 years will be even more felicitous than the first 100, of which we are all so proud. Thank you.